Okay. You feeling anything, Dad?
Just pressure, right?
No
Pressure
pain?
against you.
No.
Good. Yeah, she's just getting enough.
No, he's a trooper. I'm gonna squeeze it out. See if I can squeeze it out. Are you okay? My goodness, this little friend of yours. I think you're gonna lose a little weight today. It's like a rock. Wow. Look at that area there, huh? That is a big blackhead. You might have the award for the biggest blackheads. Oh my goodness, no, this is under there actually. Look at that, it's under there. A little bit more, but not hurting you. It's like a rock under there. You're storing a little rock under your skin. It's like rock hard. Just make sure, again, I'm not hurting you. I'm going to pull on it a little bit. I don't know if I can get this out in one piece. It certainly is satisfying when we do that.
You're okay.
You're doing too much to him? Is he okay? Here it comes. Oh, you're going to actually, your clothes are going to fit you better now. This thing is like a hump on your back.
Has it bothered you at all? Have you felt anything bad?
No. See that? Maybe it's coming out. It's just stuck on you. It's almost like it's like a raisin that gets really sort of like sticky and yes, it's like a pore liner.
Your forehead's really healed up nicely.
Yeah, it has. Yeah, it's a good healer.
Healed up nicely.
I know you were kind of concerned about that one, huh? Being something. Probably because your history, who was it again?
Dr. Stiles mentioned it, that he said that might be a cancer under there, and said you better get that checked.
Probably because it kind of grew so fast and was quite big. It was just so unusual to be so big.
Yes.
Here we go.
Yeah,
Here
my
it comes.
daughter, in fact, the one that was in, she had
Yeah, it's scary.
cancer went on her back.
Oh, wow, that one came out nice too. They're like little rocks too. They're hitting her table right here, and they're like making a little rock sound, like when you hit something. Yeah, come there. Look at this. I'm gonna look at this angle. There's like a whole little empty space here too. But I think we got all that. I'm also gonna let this heal on its own because it will slowly get smaller. We've seen this before where they will heal in and get smaller. We can't sew it up because there's just it's like a scarred off sealed area right there.
I think he's relieved, aren't you?
Feels
Did you already get it?
No, I didn't. I didn't want to. We're interrupting you. I'm sorry. We're all like ignoring you.
That's okay.
I can't listen to
It's
her.
like a little plug in a faucet. Remember old school plugs, like those black plugs
Yeah,
that
yeah.
you have in a faucet? Oh, look at that. You want to see it?
No.
Not
Don't
you.
show it to her. Don't show it
No,
to her.
really? Why?
Do you want to see it, Mom?
No.
No.
I told you.
Yeah. That's pretty wide. Come to this side. Come all the way over and see. Yeah. If I close that up, I think.
Okay. You feeling anything, Dad?
It's pressure, right?
No
Pressure
pain?
against you.
No.
Good. Yeah, she's just getting enough.
You like to watch this stuff too, Mary? Kind of.
Yeah, just mainly watching Dad.
Oh, that's okay.
Yeah, that's
But it doesn't
interesting.
gross you out, at least, you know.
Oh no.
Okay.
You were there for the appendicitis too.
Oh yeah.
Oh, he had appendicitis?
Yeah.
Oh, that's no fun. That's scary, actually.
He sent me home the same day.
Oh,
Really?
he did? You
Oh,
must be a
Dad.
tough guy. Am I hurting you?
No.
Okay,
No
I'm just
hurting?
pushing against you, okay? Because I'm going to push out this. I do believe this is a cyst and not something to worry about, but we'll check it, okay?
Yeah. And just say Dad if it hurts, because they can always numb it
Oh,
more.
yes, absolutely. A lot of times when we numb, oops, sorry, yeah, careful, there's a little pedal under there. A lot of times when we numb, we can't get underneath it very well, so I always try to, I have extra here in case I need it. I'm just trying to ease out as much of it as I can.
Okay.
All
You just feel tugging, huh? You don't feel pain though, right?
No.
No,
Good.
that should be fine. Everybody's okay, right? Everybody's good? Okay. I just try to pull. See, we got to get the whole sac wall out, so I had to tease around it. Actually, I think I'm going to give him a little more numbing, just to make sure he's good and numb. There you go. Okay, a little. You might feel a little pinch. Hopefully, not too bad. You okay? Oh, did that pinch you? I think I
A little bit, yeah.
Sorry, just putting a little more numbing underneath to make sure you're. I'm glad I'm doing that then. Make sure you're good and numb.
Yeah, because you gotta tell her if it hurts, because it's
Yeah.
easy for her to numb it.
Yeah, it is. It's very easy to do that. Exactly. So cysts like this have a very thin wall, so I just have to get it out and see how like it breaks easily. I just have to make sure I tease it all out. Underneath here. Oh, we got a baby one. And a bigger one. I might have to just do without it. That one's a little too small for me to use. So this is really superficial.
Oh, good, so it's not real deep.
Oh, yeah, no, it's not. But I need to get under it and take all that off here.
You feel anything, Dad?
Huh?
No? Good.
Good.
And
Yeah,
it's
good.
not bleeding
Good.
bad at all.
No.
Mm-mm.
No, not bad at all. Just, it's very thin to the surface. That's why I actually was open at the top there, because it was
Oh.
actually like almost like a big blackhead, really. Like
Oh,
called a
wow.
dilated pore of Weiner.
How you feeling, though, Dad? Good?
Yeah.
Relaxed? Just
Yeah.
He's just happy he's getting it done, I
Let
think,
her do
huh?
all
He
the
was really
work.
worried about this, I think, right?
Well,
Yeah.
Or
Smart,
everybody,
just, yeah.
everybody was, just to
well,
make sure it's
Dr.
all
Stiles
there.
was worried, yeah.
Yeah, probably because it came up so fast, you know?
Mm-hmm. But that's good, so they can biopsy it. And
Yeah, exactly. See, all that's still there. Right there. I just kind of push against you to squeeze it out, but it's just stuck to him. It's set up shop. It likes you. That's all. Where is it? Right?
Yeah, it's right here. It's from our most kids. Let's
Okay.
start.
Okay. Let me just trim some of this a little bit. Maybe that'll help me to get more of this out. Just wondering if I need my little light, because see, it's just kind of stuck on the head there. All right, let me scratch it. So I'm kind of scratching at it a little bit. That'll help to get all those contents out there.
Are you feeling pain, Dad?
No.
Sure.
No pain. Okay, good. She's just, it is superficial. It's not,
Oh yeah. See, and I'm just trying to scratch
Does it
its
feel like
clean.
it's really deep? It's not.
No, it's not actually. It's right there on his head, right
Yeah.
there. And that's why it was sticking out. See,
Yeah.
this is the cyst wall.
Yeah.
See, I'm trying to tease all that out. There we go, some of it. Yeah, you okay? I think she's gonna be pretty tough and power through this one. My girl here. Okay, we're just gonna get rid of all of this completely.
Okay, Dad?
I love
Okay,
how.
the color's good and everything.
Oh yeah, I'm sure. This is so minor. It just takes us a little while to make sure. I scratch
get
it with
it
this,
all.
I can, yeah. Because if I don't, if you leave a little bit of it, it can come back.
Yeah, let us come back, yeah.
And that's why you have to really use this. This device is called a curette. It's a little bit, kind of a little sharp-ish on one side. It's not really sharp. You can't
okay.
like, you can just
Tiny.
scrape at things essentially. It's like a scraper tool. I've seen people call it a really kind of cute on the internet. They say, why don't you use the croquette?
It does, it almost looks like
Cute. It does. I mean, I guess they get confused with the name. I said curette.
mm-hmm.
You call it a curette. I don't know. I guess that's the verb there. See, there's some of it right there.
Hmm.
It's just,
How you doing, Dad?
it sticks to you.
And you're not
So-
feeling pain, Dad, or are you?
No.
A little bit? No?
Oh,
Good.
I think she's trying to get you to feel pain.
No, I'm just trying to
I'm
go by
just
his
kidding. I'm
facial
just kidding. Oh, good. He's
expressions.
making, yeah. You know, what is interesting is he can probably hear it a little bit.
Oh,
It's like
can
through
you,
your
Dad?
head. Yeah, you can
Can
hear
you hear it
something
in
like
there?
scratching. A little gritty, you know, imagine if something combing your hair or something and they get caught up in, you know, you
Yeah.
can feel that. I mean, you can hear it, not feel it.
Yeah, okay, I see what you're saying.
So oftentimes that happens.
It's not bad, Dad.
not at all. It's very superficial. But I just want to get all of that out, or else, there we go. See, there's more. It's hidden under there. And that's what we need to take out, that wall. Okay, let's just dab around it and take a look. Just do one double check here at the edges, and then we're just gonna push against you. If only you could reach this. Huh? That was under there waiting to come out. I think there's more, in fact. Yeah, it's like a top of a cyst, I think. Let's get rid of that little piece right there. I'm gonna push against you a little bit. Doesn't feel bad. It actually kind of feels good, huh? That's what people say. A bit more. It's under there. There's still more in there. I think you have a cyst here. This is not really a blackhead anymore. You have a cyst that got trapped but had a bigger opening to the surface. So look, just looks like a big blackhead. And it keeps going. You're all right, huh? All right. Got it there. Okay, I'm gonna push from up here because there's something up here. I can feel it up there. Just trying to get everything out here. There we go. Let's see if I can squeeze. Wait a minute. Let's see if I can squeeze it here. Okay, pushing again. I think it's deceiving how small this is. I think it's bigger than it looks. You okay? Okay, good. I'm gonna have to show you all the stuff that comes out of here. Yeah. It's just hard because I can't squeeze your back very easily here. You can't pinch onto it. But soon you'll be able to wear those backless dresses again. Let's get all this out. I'm getting a little workout today though. Look, it keeps coming. Keeps coming. Just I can't pinch. Let's see. Okay, I might have to resort to, I don't know, I might have to resort to punching this. We'll see here. Not hurting you, right?
No.
Good. Just need to make it a little nick in the skin a little wider so we can get all that out. Oh, we may never get to your other little baby ones. This one's gonna take all our time. I think we're getting to the end now. Okay, this has definitely been there longer than 8 months. Let me just tell you.
my goodness, yeah.
It has been there longer than 8 months, for sure. To convert that to a punch. Look, I can't get it all out there. Look, it's still coming. Look at that, here it comes. I think I've released a lot of it though. Just wanting to show it all to you. My gosh, it keeps coming. Okay, come on, we must be getting to the bottom now. It's like look, it's still coming. What What the heck? Put my grr in there. Getting me a workout. What the heck? At least you can giggle about it. Oh my goodness, look, there he goes again. It's like, I'm gonna push this way now. It's like a deep tissue massage. Phew.
Oh, honey.
Okay, come on now. Am I gonna get all this out easily, huh? Let me see, maybe I try my pickups now. Of course, that are probably too big for this. Try this way. Am I gonna get the rest of this out? Let me see, how am I gonna do it? Everybody that watches our channel knows that I talk to my blackheads, so sorry, I'm gonna talk to it. Because I'm trying to get it out. And it is... It is! No one has tried to do that for you before, huh?
No.
Nobody. The first one. This one, he's decided to... He thought he was gonna set up a shop here. I might need to convert this to a punch here, I think, huh? Because look, he's not wanting to come out all the way, and I want to get it all now. Okay. Take this instead, and now let's try to put remove a little bit more of the superficial skin so we can get to the whole cyst now. Now that we know it's a cyst in there, and my wrestling paper, get the top of that off. There we go. There's the whole cyst sac there. Because a cyst has a little wall around it, like a little balloon, and if you don't take the whole wall out, it will come back, and that's why you have to kind of be very... Now we converted it, because now I know that it's a cyst and not just a blackhead. The other ones are blackheads for sure. There's no way they're like this. But if I don't take that whole thing out, it will just come right back, and you won't like that, because then you went to all that trouble. See this? Look, it's still under there, but it doesn't want to... It's like it doesn't want to leave you. Your back is it was taking up space, making your back look white, look thicker, I think. Now we're gonna thin it down a little bit.
Okay.
I can't squeeze that out though. Try both hands again. See, it's right there. Okay, let me hold it here. This is where I need 3 hands. This is where those 3 hands would come into handy. You okay? Okay, good. Almost there. We have sometimes, actually all the time, pretty much, the sac, the wall of the sac is very thin and friable, so I have to be very gentle pulling it out, but I gotta try to get it all. I think I'm pretty good now, but make sure I'm not hurting you. I'm just gonna feel around. Wait a minute, there's still something under there. This. See, there's still a little something right there. Look, I see a wall there. It's like lighter than skin color right here. You see that too? Right there. You're like my sidekick, you know, like with Johnny Carson, with like the guy who talks next to him. Valerie, you're like my sidekick. They have to, like, I talk to you because I have to talk to somebody. You're like,
Like someone else is watching it.
Yeah, you know how they have like all the late night show guys usually have like sidekicks, like that you talk, because I think they use them to talk to and bounce things off us, so they're not just talking to nobody. You know, it helps with the conversation. You're like my conversation person. You're like, come here, it's stuck. Look how adherent it is. Okay, it's coming, but not without a fight. I'm fighting it. You're okay, though? Okay. Look, it's right there. Okay, I've got it. I think I got it now. Let's just double check again. Anything under there that I can see? I don't see anything, but I'm just not totally convinced because it's. I wonder if they're looking for us. You don't think so? Okay, okay, good. Okay, feel better now, but it's still, there was like a space right over here that things could hide under. So there's a chance when you have cysts like.
Putting some pressure on you, okay?
Yeah.
We'll see how this works. Alright, well, we got part of it out here. Let's see about this other side. And you're doing okay, yeah? See if we can't get any more here. Still coming.
So I'm gonna, and I'll just see if I can. Oh, I'm wearing the wrong size gloves here. See if I can give it a little squeeze here first.
It's deep. It's
Talk
deep.
about a big one.
Oh, he did that in Cincinnati, and we stood there
Did
forever, and it kept coming.
Oh, really?
Yeah, it'll come.
And then you asked her to marry you, right? That's when you. That's when you proposed.
if you don't,
You said, "I gotta marry her."
if you don't get that
Got
whole
that.
thing out, it'll come back again.
Yep, exactly. You know exactly what we're talking about. So actually, I should have told her to bring a curette too.
No, I never seen her there, but it took a year to get her naked.
Well, I guess.
Well, it should be that way.
I guess his moves
Goodness
weren't that
sakes.
great.
That's right. His moves weren't that good. That's why, you see? She's got a good comeback for you. No wonder you guys have been together for 50 years.
Oh, I have to do that. He's something else.
He's a piece of work, isn't he?
It hurts a little, but
It does?
not
Oh,
that
okay.
bad.
No,
Not
I'm
that
going to
bad.
give you a little more numbing right under there. You know the
Okay.
device here, it's like called a curette, and it can scoop some of the edges out. Because, yeah, it's like an open area underneath there. Am I hurting you now?
No.
Okay.
No, it's all right.
It's like compacted skin under there.
I'll
but-
let you know.
Yeah, and hopefully if we leave it open a little like this, it'll heal in or at least shrink down. But I do feel like it dives down a little bit right under there. Let
So,
me see if I can
do you
feel.
get what I call it a head?
Yeah, we got the top of it. Yeah, I'm gonna open this up. It's numb here. That's why I can do this, and he won't feel it. If your husband's wondering, because don't try this at home, okay, husband?
No, oh, I
Yeah,
no,
because
I
you need
would
numb
do-
in there. to try this.
That I would have never squeezed that out ever.
Good
That was a paper.
Good job, yeah.
Nah, they don't go.
Not hurting it, right?
No, you're not hurting
See,
me.
it's underneath there. It's pretty deep.
Yeah, I know,
There's
I
still
know that
something
because that
underneath
thing's been
here.
coming back for 20 years or more.
But we have thick skin on our back, so see, we're trying to get the whole thing. See, there's like almost like a little shell of it
Yeah.
here. A little remnants here. Because that's under there. It's like it dives down into a little, there's like a little tunnel right here. So I'm going to be carefully just try to see if I can get that out of there. See, it's stuck down there. Wow, that's a good like half a centimeter down under there.
That starts with a blackhead, right?
Yeah.
I thought so, yeah.
It
I don't
is,
know,
though.
I've been prone
It's
to
like
blackheads on
stuck
my
under
back all my life. I don't
Yeah,
know
some
why.
people are.
And when I was young, a few on my face, but not all that much, you know.
So you know I have a whole channel about people that love to watch this stuff, and you're not alone. There's a lot of people that like
What is
this.
what is
So
it
you
on?
guys are gonna become the new stars. I'm serious. You guys are gonna become the new stars.
Is it on
You
cable
guys
or
are-
what?
It's on cable. No, it's on YouTube.
Oh, on YouTube.
YouTube, yeah. Do you ever go on YouTube and watch a little bit,
No,
or maybe
I
your
don't, but
grandkids
my-
or your
my
kids?
grandkids can pull it up.
Oh,
yeah.
they might see you then, because I think it's very pop. How old are your grandkids?
26 and
Oh, they might be
17.
of the age that they have heard of this. They probably already heard of
Is
it.
there a certain site that we go
Yeah,
to?
if you Google if you go on my name, if you actually go on my name, you'll find it.
Oh, okay.
Just put my Dr. Sandra Lee. You know, not my
Okay.
husband's name. It's
I'll wait a
technically.
while though, because this is just being done.
Yes.
Then I'll have them look
This
and
is gonna
see-
take a little while for us to get it actually out on video.
Of course, of course.
But I think we got it now. Let's see how well that. I think it's gonna heal better. It might still want to form something, but at least I open it up so it can heal a little slowly from the inside out.
Yeah.
Okay, and I think I got all of it. It's like there's a general hole here, and then there's one small deeper hole that I reach into, and I think I pulled all that out. Just trying to make sure I get it all. Let me do a little scrape of that.
Go ahead. I can't feel it at all. I mean, I can feel that you're scraping.
But
I
you
know
can't
that.
feel pain. Yeah,
But
that's
it's
the
not
most important.
painful,
Yeah, if
yeah.
I scratch a little bit, it might abrade it
Right.
enough that it'll seal up.
Right.
And we have you on that antibiotic anyways because you have that one that's a little inflamed. Yeah. Oh look, I am getting some stuff coming out.
Oh, I know it's
Like a
deep.
cyst
It's
wall.
been coming
Oh,
back
yeah.
for years and years.
Yeah, I don't know how because you would have gotten rid of these sooner if you yourself could have scraped them, but you can't.
Yeah, I can't see them actually,
Yeah.
and they don't hurt or nothing. And well, I don't really look at my back in the mirror, but I should.
Well, you're much cuter coming, you see, so that's why. That's more important. So there's a smaller one here that I'm taking away from your husband. I'm sorry.
That's good.
Sorry about that.
Take
That I'm
them all
taking this one away from him.
because
That's the kind he likes right there.
It hurts when he does.
Make sure that pore is exposed. It looks like it is pretty much though. There's one under there just waiting to come out. One of these days I'm gonna let Christy do it for me. I know she wants to. See if it will even come out. See, I think I might need to punch it because they're so stuck in there. You've been storing this one in there for a while.
I tried to keep it a secret.
You did, huh? There we go. I think it's nice because we got the little sack there. See, right under there. It was under there. There we go. We'll do this first and see. Otherwise, we'll do a little punch. Get it all out whole, maybe. See, there's a sack there, the white part here. Let's see it. Yeah, we can pull it out like that. Sometimes they're still a little friable. Maybe we'll use that. Here, let me try to push it one more time first and see. It keeps coming. You okay?
Me?
Yeah?
Oh, I
You're
Feeling-
joyful.
good way to lose weight.
Keeps coming.
I feel better already.
You do, huh? I like that. It's been there for a while and it's very like clean. It's very like untouched.
Well, it's in a place that it's awkward.
The hardest place for you to reach, huh? Yeah, I think if we, let's take a little bit that way. There's no way, so I need to take a little punch. See if that won't help us to get it all out. Push it first here because it's under there. There's a little sac under the skin, and we gotta try to get all of it.
Mm-hmm.
And another piece of gauze. There's a little sac under the skin, and we gotta try to get all of it.
Mm-hmm.
And another piece of gauze. Thank you. It's like a hidden one under there. Thank you. Sorry, take it. Pick a film outside, it's still there. Pick a film outside, it's still there. We're getting there. What should I do to get the rest of this out, huh, girls? No, I mean, there's just still a little bit more underneath there, even though there's a little. So what were you thinking was back here? You could just feel a bump, but you didn't really know exactly what it was?
No, I didn't even know I had it.
Oh,
I
you-
came
oh,
in
you
for
didn't?
the
I'm gonna push on you.
skin cancer, as I said, and then a body scan.
Uh-huh.
And when he did the body scan, that's when he saw the large blackhead.
Got it. I might need a pickup for this. This is called a pour. Am I pushing too hard on you?
No.
Okay. Because it's kind of, it's an awkward area because it's your ear and it's flexible there. You know, there being cartilage there. So it's actually kind of hard for me to, right, here we go, to kind of pull it out without using a tweezer or forceps. Oh, I think I can get it with this though. How's the lighting on there? Okay, not too many shadows. Look at that one. I gotta show this to you. You were storing something in here. You could smuggle diamonds or something across the border. There we go. There's most of it. There's a little bit of skin right here. Let me just see if I can pull that. Looks like that's just part of your ear here. Let me just make sure. Just a little bit of fibrous tissue right here. Good. Nice and flat, and that will heal just fine right in the back. Okay, drop it for me. So these don't bother you at all. Did you feel a bump here though, I'm sure. But you just don't. It doesn't really do anything matter to you. But it's nice to get them off. That's very satisfying right there. You have a little one here. Maybe I can take it off without making a nick. Yep, got rid of that. Okay, let me go to there. And let's get the milia first. I mean the whitehead. Whitehead first. And a couple blackheads. The difference between them is a whitehead is like a closed comedone, and the blackheads are open comedones, meaning they're exposed to air and they turn dark because they're oxidized by oxygen. By oxygen, obviously. There's the little ones here. Not done popping? Check out this next video or check out my all access membership page to watch more videos.